For my research project, I have decided to research technology and speech delays. The question is, how does technology benefit early childhood students with speech delays? Overall, around 50% of children have been affected with speech delays, typically kids aging from 2 to 7 years old. When COVID arose, it affected children, especially under the age of 5. Some of the risk factors can include family histories, male gender, low stimulation, hearing issues, low parental education, and difficulty in the household. It has been found that early speech-language therapy can typically improve speech development at an early age. Technology has allowed therapists to offer more personalized and effective treatment plans for their patients, resulting in better outcomes. Some of those include mobile applications, teletherapy platforms, argumentative and alternative communication devices, and artificial intelligence and machine learning. Mobile applications provide more convenient and engaging ways for the patients to practice speech and language skills. Some of these include support for articulation, fluency, and vocabulary. Some of the common apps include Articulation Station that covers speech sounds, different levels of difficulty, and is fun and motivating for the patients. Another is Speech Blurbs. This is a mobile application for children that includes videos, interactive activities that are playful, includes new words, sounds, and includes sentence structure. Voice Therapy is an app for adults that includes exercises, provides them with feedback, and makes more personalized experiences. Teletherapy platforms have become more popular, and they began to arise during the COVID times, as it allowed speech therapy to be done remotely. It has made therapy more accessible for those who have difficulty attending in-person appointments. Some of the benefits of teletherapy platforms are that people have increased access. People who live in unserved areas can receive therapy using technology, and it benefits those who have mobile challenges or live in rural areas. Teletherapy also offers flexible scheduling and can accommodate for busy lifestyles and reduce the need to take off work or school for the parents or the child. It also enhances comfort, as patients can have the comfort of their own home during therapy sessions, and it will result in a more relaxed and productive session for the patients and the therapist. The argumentative and alternative communication devices are essential for those with severe speech delays. The devices go from simple communication boards to sophisticated speech-generating devices. Some examples of those are Proloquio2Go. This is a customizable communication platform that you can create personalized boards that turns symbols or text into speech. There's also Tobii Dynavox, which is an eye-tracking technology that is used by tracking eye movement, and it mostly benefits those who have ALS or cerebral palsy. Next is artificial intelligence and machine learning. This is important for speech-language therapy. These technologies allow precise assessments and personalized treatment plans. Some of the examples are linguistic analyst software. It analyzes a patient's speech and allows the therapist to develop a targeted treatment plan that is individualized to the patient. Next is voice recognition. This can assist in diagnosing speech disorders and can monitor progress over time by tracking improvements and adjust the treatment plans according to the individual. Next is screen time that must be focused on. It's important to be considerate of how much screen time that families are allowing their child to use during these services, as it can be harmful for those who already have a speech and language delay. Typically for babies, it is important to not include screen time unless it's like a FaceTime call with a relative or friend. For toddlers, 18 to 24 months, an hour or less is best. For children 2 to 5 years old, 1 hour or less on the weekdays, as they may be in school, and 3 hours or less on the weekends. For children that are 6 to 15 years, less than 2 hours is recommended. Next is the benefits of technology for speech-language therapy. It enhances engagement for the patients because the technology can make a more engaging and interactive experience by using games and other tools. They use play and competition, and the digital tools motivate the patients to regularly stay involved with their sessions. It is also personalized. These therapies can be personalized for children to use digital tools that allow therapists to personalize treatment plans. This improves outcomes and patient satisfaction. It provides real-time feedback and progress tracking to help therapists adjust their exercises to match each patient's changing needs, to provide the best services they can. The technology has improved data collection. The technology allows accurate tracking and patient progress that gives therapists the important data that they will need to improve their treatment plans for each individual patient. The data-driven approach supports better outcomes and encourages collaboration by making progress reports easily shareable with patients and families in an appropriate amount of time. There's a greater accessibility to therapy sessions as it is technological. It allows access to those who have physical complications. Maybe they don't have a car, they live in a different area, they can't walk, other things like that might get in the way. It also has mobile apps that make it easier for patients to receive their treatments from home, and this expands the reach of speech and language services to anybody around their area. Next is the challenges and considerations that we must make about using technology for these services. Some might have technology limitations, or they lack the familiarity with technology. This can hinder some patients from using these digital tools. Privacy and security is important to look at because it is important that therapists are protecting their patients' data while using the digital therapy platforms. The therapist must follow the privacy guidelines strictly and use secure storage for communication to ensure the confidentiality. Next is the personalized approach. Technology should support, not replace, real therapy sessions face-to-face. The experience of speech-language pathology is important to have face-to-face with a therapist. my resources, and thank you for watching. Overall, it's essential to monitor screen time, especially for those who are young, and that they're not spending too much time on devices, as it can hinder their learning experience. And we should also keep in mind that some may not have access to technology. However, these technology benefits for speech therapy may make it more beneficial for families who cannot travel or live out of the area of speech services for their children.